I'm so happy to see all of you here. What a fantastic crowd and what a historic day. My name is Dr. Pamela Peek. I'm a proud fellow of the American College of Sports Medicine. I'm assistant professor of medicine at the University of Maryland. And probably most importantly, I like to move, like all of you do here. I am a senior Olympic triathlete and sit on the board of the National Senior Games Foundation. Really loving this incredible opportunity to be able to launch and announce a historic partnership between three industry leaders in fitness and medicine as well. And that is the American College of Sports Medicine, the American Council on Exercise, and the Medical Fitness Association. The marrying of fitness and medicine, at last. Dr. Benjamin, who you'll be hearing from soon, and I have long struggled, long before Exercise is Medicine, which is the overarching campaign, was ever launched. We struggled because we were writing too many prescriptions like this. This is my actual pad. And then one day, both of us, out of sheer frustration, decided to start writing exercise prescriptions. We took an actual prescription and we wrote down, please, just get up, move, assume the vertical, a lot. All day long, keep moving, anything you'd like to do. The first time I ever did this, I did this out of utter frustration in talking to someone who didn't seem to really be listening. And so I just wrote it down. I said, here, take this. And I signed it, and I said, refill, and I put the infinity sign. It was late in the afternoon. I didn't have enough coffee. I handed it to this individual who was a very successful leader in the business community, a woman in her 50s. And she came back about 3 weeks later in follow-up. And I said, how are you doing? And she was absolutely glowing. I said, wow, what's going on with you? And she says, well, I did the prescription. I said, what prescription? And she said, you know, the one with the exercise. I actually have it up on my bulletin board. I said, you moved? You actually moved? She said, yes. You're a doctor. You wrote it. Son of a gun. The power of the pad. So we started doing this a lot more. I don't have to do this anymore because now we have the power of this pad. Exercise is medicine. We've done all the work for you as physicians, as fitness professionals, as any of the medical care providers out there. Now all we do is we just sort of fill it all in. Thank you very much for writing down all of the guidelines that we need to be able to share with our patients, with anyone out there, whether it's a fitness professional who is just trying to guide someone, or it's a primary care professional. It all comes together. Today we marry the two, and a magnificent marriage at that. And we have amazing people to be able to message this today. The leaders from the three organizations I just mentioned, which represent, by the way, 50% of all fitness professionals. This is truly a historic and groundbreaking milestone, something we've been dreaming about for a long time. I also want to make certain that you know that all day long we're going to be talking to legislators and their staff. We're going to be talking to medical societies. We're going to be spreading this word, but we're launching it right here. And I also want to acknowledge one of our wonderful legislators who has come to join us as well, and that is Representative Renee Elmers from the great state of North Carolina. We will also be hearing from people who are exercise as medicine, as it were, success stories. Amazing things happen when you stand up and begin to move, or even sit on the floor and move. It all works. You'll be hearing more about that throughout the entire day. We say all of this within the context of healthy lifestyle. That means you're eating healthy whole foods. That means you're working on stress management. And at the same time, you're also doing that essential critical element, becoming more physically active. That's what Exercise is Medicine is all about. And as you'll soon learn, it's also a global phenomenon. It's about prevention. And I don't know anybody better than the next speaker, our keynoter, to be able to speak to this. And that is my dear friend and colleague, the 18th U.S. Surgeon General, Dr. Regina Benjamin. Oh, heck, I'm not even going to read all that stuff. I've known her for too many years. Just remember that. Knowledge is power. Who doesn't remember the story of Dr. Benjamin's ascension in our field? She is a MacArthur Fellow. What's really important about that is how she received that incredible honor. She built a beautiful little clinic in a shrimping town, Bayou La Batre. It was destroyed by Hurricane George. She rebuilt it again using her own funds. It was destroyed again by Hurricane Katrina. She rebuilt it again. And then it was burned down. It was like, that's it, number 3. And the great news is it was built up again. It's called persistence, consistency, and an incredible passion to help other people. This most definitely was recognized by not just the MacArthur Fellowship, but also by the president, who appointed her again, nominated her for U.S. Surgeon General. She did this work for the 4 years she was Surgeon General by concentrating again on a commitment to one thing that you'll be hearing about, and that is prevention. Currently, she holds the endowed chair in public health sciences at Xavier University and continues her work not only at the clinic, always circling back to touch people's hearts, but also in her board work and her public policy work around the United States. She is also with us in Exercise is Medicine, on the board, chairing the board, helping us to be able to continue to message both prevention and treatment. With that, the 18th U.S. Surgeon General, Dr. Regina Benjamin.
Good morning. Thank you all for being here. And Pam reminds me, I'm back in the clinic most of the time. That's where I spend most of my time now, is at the clinic. But there's a lot of wisdom in older people. And one of my elderly patients says, I want to get old, but I want to be upright. So the people in this room understand what that means. One of my friends also told me about one of her elderly patients who said, she said, well, why do you stay so active? She says, every morning when she wakes up and gets out of bed, she jumps. She said, jump. Why do you jump? She says, one day I won't be able to jump. And as long as I can jump, I'm going to jump. And if you think about it, it takes a lot of muscles, a lot of energy to jump. And hopefully we'll be jumping into something new today, as you'll hear about more. As you know, I'm a longtime champion of the power of prevention. And it was the foundation of my work as Surgeon General. And it's also the foundation of my work as former Surgeon General. While I may have left the position, I did not leave the mission. I believe that prevention offers the greatest opportunity to improve the health of America's families now and for decades to come. I also believe that prevention is the key to building a stronger and more sustainable healthcare system. And prevention is not new to the national dialogue. However, in recent years, it's become more vital and more relevant than ever before. It's now an imperative. And that's largely due to the changing dynamics and the demographics as more American families struggle to deal with chronic diseases like diabetes and hypertension, strokes, mental illness, and behavioral health issues, and the devastating toll that they take on the individual, the family, and the community. You know, much of the illness and the early death related to chronic disease is caused by just 4 modifiable health risk behaviors: lack of physical activity, poor nutrition, tobacco use, and excessive alcohol consumption. Did I say lack of physical activity? Lack of physical activity. And by the way, this is the February's Women's Heart Month, and more than 800,000 Americans will die this year from heart disease, and the overall cost of heart disease and cardiovascular disease is estimated to be $444 billion every year. So we have to make prevention part of our everyday lives and empower people to make better health choices. And so many of you have heard me so many times say that health does not occur in the doctor's office and the hospitals only. Health occurs where we live, where we learn, where we work, where we play, and where we pray. But today I can also tell you it can start in the doctor's office, and it can start with that prescription that Pam was talking about, that prescription pad for exercise from the clinician, from the doctor, from the nurse practitioner, from the PA, the nutritionist, right there having that prescription. And Exercise as Medicine Solution is this new and innovative approach that, well, I say new, we've been doing it, but it's innovative in the fact that it uses that prescription pad to link the medical profession with the certified physical activity professionals and the resources in the community. A formal way to put them together. We basically can now find a clinician who now can refer to a certified professional, physical activity professional who we know is qualified. And that person can send us reports back, and that circle is linked. There are 3 things that the clinician can do when the patient comes in. They can assess the physical activity levels of each patient at every single visit and document it in the electronic record, and document it prominently there. And we can provide patients at that point with a prescription that's tailored to their particular chronic disease condition. And then we can refer that patient to a trusted network of local evidence-based physical activity programs and professionals that are basically run by qualified and certified professionals. And so, as I mentioned earlier, much of the illness and early death related to chronic diseases can be prevented by increased activities. So Exercise as Medicine Solution is going to enable health and physical activity professionals, again, to work together. And by working together, the patients will benefit, the clinicians will benefit, and America will benefit, and we will make America a more healthy and fit nation. So I'm here to just commend the 3 organizations: American College of Sports Medicine, Medical Fitness Association, American Council on Exercise, for this wonderful vision and your leadership on this topic. And I look forward to working with you and working with America to make America a better and more healthy and fit nation. Thanks.
So I promised that for every single one of the leaders, including Dr. Benjamin, that I would also make them real people. We don't just sit here and pontificate. So you already know that I love to move. She does too. We hiked the Grand Canyon rim to rim and stayed overnight in Phantom Ranch, and that was a hike that will be, that's right, and she danced too. I think she was delusional when we finally hit the 11 miles down, but it was a lot of fun nonetheless. Speaking of physical activity, I would love now to introduce Robert Boone. Robert Boone also loves to do physical activity. I understand there's some skiing going on and some hiking and a lot of assuming the vertical, which is very important. He is the CEO of the Medical Fitness Association, and he's been a pioneer in the field of wellness and fitness for over 25 years. And what's really unique here about medical fitness, per se, is you say medical fitness, what does that mean? And that means he's been overseeing the operation of medically integrated fitness centers, which are so innovative. These are hospitals that now open up a fitness center that then marries all of its work and alliances with providers in the local area. And we have so many examples of this now. Very exciting to be able to see all of this come together. Bob, come on up and share your thoughts. Bob Boone.
Thank you, Pam, and thank you, Dr. Benjamin. Dr. Benjamin was just spot on with her thoughts and comments about where we need to go as an industry, and we in the Medical Fitness Association are really excited to be here today. So before I sit here and pontificate for a minute, I want to introduce you to one other person without whose vision none of this would happen. Michael Richmond is a past chair of the Medical Fitness Association, and it was his vision 2 years ago that brought us together at a hotel at a Chicago airport where we brought the ACSM and ACE and us together. So I want to take just a moment and introduce Michael Richmond, let him say a word or two to you.
Thank you. The creation of the collaboration of the collaborative exercise medicine solution among the American College of Sports Medicine, the American Council on Exercise, the Medical Fitness Association, organizations with sometimes differing interests is really a remarkable accomplishment. My congratulations to all those who worked hard and selflessly to make this a reality. The Exercise Medicine Initiative, however, transcends any one group and even today's triumvirate. It recognizes our common purpose of delivering a vital component of the healthcare continuum while holding down healthcare costs and opening the door to a healthier society. I'll leave the science behind it to the physiologists and physicians, the economics to the MBAs. Did I say NBAs or MBAs? MBAs. But I can tell you that today we have risen the bar of expectation of the quality of our fitness leaders and programs. We have made quality fitness education and programming more accessible to all of our brothers and sisters, sons and daughters, and in that we should take great pride. I know of at least one enthusiastic exercise physiologist, Marla Richmond, who left this earth way too early, who could not be with us today. But she had a passion for delivering complex physiological concepts and life lessons in a fun and always interesting manner. She would have vigorously supported the breaking down of the boundaries for the development of a common good, our common purpose, the improved health and wellness of our population. Always spiritual, I will leave you with a brief excerpt from one of her lessons called Balance and Joy. Good health is not guaranteed. In fact, you must pursue it. Strengthen physiology while adding joy into it. Be flexible in heart and mind as well as body tissues. Be present in each moment and resolve important issues. The parts of healthy living, like a puzzle fit together, must be practiced daily from this second till forever. The Exercise Medicine Initiative, while this might not be the initial moment, is one that is of such great importance, and may it last until forever.
Thank you, Michael. The issues we're trying to solve here today are not new, but they are difficult. Research shows us that over 80% of what goes wrong with us as humans, we bring upon ourselves, either by what we choose to eat, the lifestyle choices we make, the stresses we carry. All those decisions that we make impact our daily health. So if 80% of that is controllable, then guess what? If we control it, we can not only begin to bring about the promises that prevention has given us for the last 40 years that we've never realized, but we can truly begin to impact the health of lives. We can begin to meet the vision of population health, and we'll do that one person at a time. So many times we look at and we talk about prevention and we talk about how do we make this work. Up until now, we've really not had the mechanism in place to create accountable health care, to create personal responsibility, to create an ongoing feedback loop that keep patients motivated, that keep physicians informed, that keep us all in the loop so that we can work together to modify lifestyle choices. I had the pleasure last fall of spending some time with the American College of Lifestyle Medicine, and I'll share one quick lesson I learned from them, which I thought was wonderful, and you heard it alluded to just a moment ago. Eat real food, not so much, mostly plants. If we can remember those things, three quick, easy lessons, that's one of the things that on the nutrition side will bring us a long way towards our health. What we're doing here in Exercise as Medicine is something very similar. We're saying exercise, measure, monitor, repeat. Right? So that's what it's all about. That's what we're here to do. And the Exercise as Medicine program brings together 3 organizations. The reason we've come together, ACSM is largely, has done a lot of research in this area, along with many others that are involved. But they've brought together the research component. ACE and ACSM bring together the credentialing component for the professional. And in the MFA, we bring together the access points and the certification of the facilities that say, hey, we're a trusted source for you to send your patients, physicians, and you can guarantee by coming to a certified facility, by using our certified professionals, that your patients will be well cared for. And that's the essence of creating the platform that we're here today. But there's a really critical component that's missing here, and that's the physician, the referral source. So I want to introduce you now to a physician who works closely with us, who has incorporated Exercise as Medicine into his program. So I want to introduce you now to Dr. Cliff Morris.
I brought a prop. Thanks, Bob, and it's truly an honor to be here with Dr. Benjamin, Dr. Peak, and everybody that's here. I come from the front lines of trying to incorporate this Exercise as Medicine principle into our everyday practice. A few years ago, I left a very large cardiology practice and did something really crazy. I started my own practice and decided to place a gym with nutritionists and exercise enthusiasts in my office in addition to trainers. And they thought this was a crazy idea. I thought this was a great idea. It makes plenty of sense. I didn't bring with me my patients, but what I brought with me was the container that I have here that's at our front door. And these are the folks who have come off of their blood pressure medicines and their diabetic medicines. These folks feel good just after the first week in our medical fitness center. It's a wonderful symbol, and wouldn't it be wonderful if every practice had one of these? Yes? All right. So as a part of me being here, I just want you to know that we are all important in this mission. Everybody in here, Lori, where are you, Lori? Sitting, there she is over there, our exercise physiologist, our kinesiologist. As a physician, I'm trusting all of my patients to people like Lori who know what they're doing and can help me accomplish the things that I'm here to accomplish. And my final word to you today is if you want to look at a culture, which is what we're trying to do, we're actually trying to change a culture. And if you want to change a culture, you have to look at the stories. But if you want to create that change, we have to do that right now. And we don't have time. Diabetes, heart disease is on the rise. We have no time to wait. So let's change the culture today. Thank you.
Thank you, Cliff. Isn't it exciting to see what happens when everything comes together? I love it when a plan comes together. By coordinating the care across the continuum of care, these are the exciting things that we can see happening, and that's the reason that motivates all of us to come together, all 3 of our organizations, is to make truly a difference in the lives of people. We talk a lot about population health management, we talk a lot about value-based care, community care, all these things. All of them come together in this group coming together so that we can truly impact population health one person at a time. Thank you very much.
Before I introduce our next speaker from ACSM, it reminds me how global we are. How many countries are we now in? 43 countries. And this is one of the reasons why I invited Amir Payam and the BBC, who is filming this for us today, because this isn't just a national movement. This is an international movement. We're holding hands and networking and partnering around the world, and it just keeps growing. So just to show you what a fertile ground we're working with right now when we're marrying medicine and fitness. Dr. Adrian Hutber, I've had the absolute pleasure of working with for more years than I care to admit right now, I think, is the Vice President of the Exercises Medicine campaign with the American College of Sports Medicine. He is a real person. He is an expert in martial arts, which is why I never, ever tangle with this man under any circumstances. He has literally commandeered the networking and the creation of Exercises Medicine as a global campaign around the world. He has given talks at conferences in over 40 countries. He works tirelessly, which is why I can never get him on the phone. He's somewhere out there around the world doing his thing. And what a phenomenal success we've had in establishing Exercises Medicine because of Dr. Hutber and his team. Dr. Hutber.
Good morning. Thanks, Pam. You make me sound interesting. It's a pleasure to be here on behalf of Exercises Medicine. Today, Exercises Medicine has become a teenager. Let me take you back a little bit to when it was born. How did it get here? In 2007, the then presidents of the American College of Sports Medicine and the American Medical Association came together with a vision that they can essentially improve the quality of care if they could join medicine to fitness, to be able to take advantage of the scientifically proven benefits of physical activity. And that's how the Exercises Medicine Global Health Initiative was launched. Within 3 years, we had people from all over the world coming to us and saying, this is not a US problem. This is a global problem. Can we join too? So we talked to my boss, Jim Whitehead at the American College of Sports Medicine, and our board. Jim, we've got some good news for you. There's global interest. Jim, we've got some bad news for you. We need to take this global. So we were able to take this in many countries, and we're very proud of what's been able to accomplish all over the world. The thing that is worth knowing is for the first few years we had to build awareness, and we think that we've done a pretty good job of that. Now Exercises Medicine is becoming a teenager. It needs to transition to a new phase, and we're calling that the Exercises Medicine Solution. Well, what does that mean? It means quite simply this. One of my colleagues at the American College of Sports Medicine, who's a physician, said, if a patient comes in and they have a chronic disease, she can give them a prescription and they can go out and fulfill that prescription at a pharmacy. If she gives them advice about physical activity, where's the pharmacy? Where's the exercise pharmacy to send that person to that helps them change their behavior outside the office? We haven't had, until now, really, an organized exercise pharmacy. So Exercise Medicine Solution is saying we're going to provide exercise pharmacies at access points that you heard Bob Boone talk about, and in the community all around the country and hopefully all around the world to connect these two together. So there's 3 or 4 important things that we need to do here, and I'm going to introduce some colleagues that are going to talk about what they've done in their community to make this happen. To make this happen, you've got to do, first of all, train the physicians, right? Physicians are not typically trained to be able to know how to do physical activity and lifestyle medicine. That's got to change. So we're going to see in a minute from Dr. Jennifer Trilk a pioneering healthcare system that is making that change. Once the medical students have been trained, then they've got to go into a healthcare system that's visionary enough to actually be able to take care of acute patients while still integrating this into their system and being able to marry what they're doing in clinical to the community. And I'm going to introduce Dr. Sean Bryan from the Greenville Healthcare System. Then once the physician's done their work in the office, they've got to send them to somewhere. Where is these exercise pharmacies? And Scott Badley, who's the CEO of the Greenville YMCA, will be up here to tell you a little bit about what they're doing in Greenville. And then finally, once you've got all of this, we need data. We need data to show it works. We need to be able to prove it. We need to prove it to medical communities. We need to prove it that what we're doing works. And I'm going to introduce Dr. Felipe Labello, who's the guy that's in charge of really collecting all this data, a part of the team. So I'd like to begin by inviting Dr. Jennifer Trilk up here. She is a professor, assistant professor at the Greenville Medical System, and she's going to tell you the innovative work that she's doing to introduce this to medical students. Dr. Trilk.
Good morning, everyone. Dr. Peak, Dr. Benjamin, last time I saw you speak was a couple years back. Was it good? It was great. And I want to tell you that I was a postdoctoral fellow at USC in Columbia, and I walked with you, with the Surgeon General. I was so proud as a fellow. And here I stand again today in such incredible circumstances. And my new thing I get to take home is, to the students, assume the vertical. So thank you. I'm an assistant professor at University of South Carolina School of Medicine, Greenville. And in 2012, USC School of Medicine, Greenville opened their doors with the goals of training tomorrow's physicians who understand the importance of preventative care and who are educated in today's healthcare climate of value-based care. Given the current epidemic of diseases related to lifestyle, obesity, and sedentary behavior, we know that it is imperative to train future physicians to understand the relationship between physical activity and health. USC School of Medicine Greenville is a new school of thought. We literally say we are a new school of thought, where tomorrow's doctors train with today's physicians and all members of an interdisciplinary team from day one. We're proud to say, very proud, that USC School of Medicine Greenville is the leading institution that incorporates exercises medicine as a required teaching component across all 4 years of the undergraduate medical school curriculum. Thank you. We also provide students an opportunity to do research on the benefits of exercise for health. This ranges from community-based interventions to where we're doing group-based virtual reality hand cycling in spinal cord injured patients, as well as out in the community and testing mitochondrial oxidative capacity in breast cancer survivors. For the Exercises Medicine Greenville program, we've brought together a great network with Greenville Hospital System and the YMCAs and EIM Global to help bridge the classroom to the community on the benefits of exercise for prevention and treatment of lifestyle-related diseases using the exercise prescription. In addition to the program, we have partnered with Exercises Medicine Global and put together a scientific research steering committee to examine the effects of exercise as medicine on our main goals: hemoglobin A1C, hypertension, hyperlipidemia, and weight. The research outcomes from the Exercises Medicine Greenville program will provide evidence using the exercise prescription in the healthcare setting for community health and for population health management. So we are very excited to promote Exercises Medicine Greenville and to share our experiences as we move forward. Thank you.
Thanks, Jennifer. That's great. And we would call upon all of the other medical schools to follow this example if you're not already started on this process, and to begin to educate medical students in a systematic way so that they can continue to take care of their patients in acute medicine, but also think about the preventive medicine and make that part of the curriculum. What a great example you are. Thank you. So once the medical students are trained, then we have to have a system that is ready to be able to integrate it into the way that they practice medicine. And I would like to invite up here to, as an example of the Greenville Health System, Dr. Sean Bryan, who is the chair of family medicine. Dr. Bryan.
Thank you, Adrian. Good morning, everyone. I am thrilled to be here this morning. My whole career has been devoted to family medicine and primary care sports medicine. And this initiative really marries those two things together in an amazing way, in a very patient-centered way. I've been a family physician, a primary care sports medicine physician, and a member of the American College of Sports Medicine for 17 years. I've been the chair of family medicine at Greenville Health System for the past 3 years. And Exercise is Medicine Greenville is truly a multi-organizational and multidisciplinary team effort, and it's extremely patient-centered. The EIM initiative and solution align perfectly with GHS's vision, as well as the Institute for Healthcare Improvement's triple aim, and the mantra for all primary care sports medicine physicians. The GHS vision is to transform healthcare for the benefit of the people and communities we serve. The IHI triple aim is to improve the health of the population, to improve the patient experience, and to lower overall healthcare costs. And the mantra for all primary care sports medicine physicians is that every patient is an athlete. Some just don't know it yet. So what we've done at GHS is we've embedded an exercise vital sign into our electronic medical record so that at every primary care visit, we can track whether or not patients are meeting the goal of 150 minutes of moderate exercise or more a week. We can then, our internal medicine and family medicine clinicians can then decide whether to give exercises medicine educational materials to the patient and or to refer them to EIM credentialed exercise professionals. And then we get communication back from them and we can track their progress along the way. So I thought it would really be great to hear from one of our frontline physicians, an internal medicine physician at our Greer practice, who is extremely excited about this opportunity as well, just to drive home, what this means on the front lines of patient care every day. So Dr. Adam Shear said, "We are all very excited to welcome our new partnership with Exercises Medicine. We think that Exercises Medicine will bring great opportunity for lifestyle change and improved health and happiness to our patients and our staff. In order to be role models, our providers and staff are going to take part in the program before we offer it to our patients. I've mentioned the program to several patients already, and they seem very eager to jump in and get started. I believe that Exercises Medicine program is going to play a major new role in improving lifestyle, health, and happiness in our patients and in their families. Thank you."
Thank you, Sean. The key thing to remember here is that Dr. Bryan and some colleagues are champion physicians, and they are already in the business. They have been doing this for a long while. But what we learned from them, and we had to really pay close attention and listen to what they were saying, is that they are busy physicians who, generally speaking, as a body throughout the United States, don't have the time to spend to change the behavior of the patient in the office. They need a support system to be able to refer patients to outside the office that can engage with more time to change the patient behavior. The doctors are the spark. They motivate the patients, but we need people to actually then use that motivation to change behavior. And that's why I'm pleased to introduce the next speaker, Scott Badley, who's the CEO of the Greenville Y, who's essentially providing in the Greenville community the exercise pharmacies that we talked about that have to be great partners with the healthcare system. Scott, please.
Thank you, Adrian, and good morning. As a part of a national charitable nonprofit association that's about youth development, healthy living, and social responsibility, the YMCA of Greenville strives to improve the quality of life of everyone that we touch. As such, we're committed to being the service provider to our Greenville health system, our medical school partners, to deliver physical activity intervention in prescribed, safe, and effective manner. Due to the rising epidemic of obesity and related diseases within our community, the YMCA and its partners have adopted Exercises Medicine as a key way of offering solutions to those patients who are ready to take control of their health and well-being. The YMCA's goals when addressing chronic health concerns are to change patient behavior through supporting a physician-led, patient-centered physical activity intervention team, remove economic barriers to participation so that no one is denied access due to ability to pay, and to provide multiple convenient access points for exercise as medicine programs so that everyone may participate no matter where they live or work, and to credential YMCA staff through exercise as medicine to become specialized, knowledgeable, and capable as members of a select physician-led team that improves patient health and healing. We are convinced, and we're thrilled in Greenville as a partnership to be able to work with exercise as medicine and demonstrate that physical activity intervention is in fact the solution. Thank you very much.
Thank you, Scott, and we look forward to other YMCAs and other organizations in this country being able to follow your example and be able to provide access to these patients throughout the country. So, what do we have to finish with? We have to really talk about, now we've got all of this program implementation, what a massive amount of data we have to do to coordinate, to prove that it works, to show not only its efficacy, but its effectiveness, and that it actually works in the real world. So I'd like to introduce Dr. Felipe Lobello. Felipe is Associate Professor at Emory University, and he's also the Director of the Exercises Medicine Global Research and Collaboration Center there. So my colleague and friend, Dr. Felipe Lobello.
Good morning. It's a pleasure to be here, and as you've heard from all of our colleagues, this is an exciting opportunity for us to really bring about change in the way we deliver preventive care, not only in the US, but across the world. But we're in a big problem right now. Changing US healthcare delivery and focusing really on prevention is not going to be easy. We've been doing things in a different way for a number of years. You all have heard about the transition from volume to value-based care, the implementation of population health management, and at the end of the day, you're hearing this word over and over around change. You know, there's going to be change in the way we educate physicians and primary care providers around the importance of lifestyle. There has to be change in the way health systems and clinical settings connect with the community in order to provide preventive strategies for lifestyle modification. And you also have to assess change at the patient level so that the things that have not been happening before, the actual change in behavior, is implemented and evaluated in a rigorous way with quality assurance. The reason we haven't really been able to bring about the promise of prevention is probably because there hasn't been enough quality assurance, quality control on the concept of clinical to community linkages. And that's why, as part of the Exercises Medicine Initiative, Emory University School of Public Health, we formed the Exercises Medicine Research and Collaboration Center to really become the academic hub that is in charge of evaluating not only the effectiveness of the clinical and community linkage, but also the cost effectiveness. I'm a public health physician, so I have to throw out some numbers here to make my point. Physical inactivity is not only associated with a huge burden in terms of chronic diseases, but also a huge economic toll, more than $100 billion a year. And the per capita difference when you compare inactive individuals to active individuals is also staggering. It's been recently estimated at more than $1,300 a year. So in order to really show that exercise medicine is working, we also need to be able to show that there is a cost-effective approach. And in order to assess that, we need to bring data from clinical settings, from the behavior change that happens in the community with the help of fitness professionals that are certified, and also data from claims and healthcare costs in order for us to make a compelling case that this is not only a nice initiative and we all agree philosophically with it, but that we can work with health systems, with payers, with insurers, with technology companies to really bring about implementation in real life and show that it works. So I'm excited to work on this initiative and looking forward to hear more about it. Thank you very much.
Thank you, Felipe. So I'm going to leave you with this thought. Whether you're on the community side or on the clinical side, whether you're on the research side or the cost-effectiveness data collecting side, please join the initiative. Those of you who are here, tell your friends about it. Let's really work together, because it really is going to take a multi-sectoral approach to make this work, and we can do it together. We can begin to make a change to what's going on. I would like to personally thank Dr. Benjamin for her leadership as the honorary chair of the Exercises Medicine Initiative, and for her continued support and guidance in this. Thank you. And for Dr. I'd like to thank Dr. Pam Peake as well, because she's always able to help us be able to communicate this so effectively. And as I said, she can even make me sound interesting. Thank you, Dr. Peake.
How many medical professionals are here today? Oh, this is fantastic. Look at them all. And fitness professionals? Yeah, all right. I just noticed Dr. Mark Kukazilla. Yes, raise your hand. Yeah, on faculty on the University of West Virginia, the great state of West Virginia. And every time I look at you, I conjure, that's right, I conjure memories. We ran Boston together in 2012, and if you know anything about that year, it was the hottest Boston in its 116-year history. Thank you very much. And it just proved to me that we were both descendants of reptiles or something. I don't know. So, only way we made it through. Dr. David Sapkier, where are you? There you are, walking with a doctor. And we'll be hearing more about that later on as we do our congressional work later on at the hearing. But a brilliant idea, something that Regina and I have done for many, many years. There's nothing like getting somebody up and getting them outside to open up. You have to have time to do that. 8 minutes doesn't cut it. So you have to have a curriculum like yours to be able to pull something like that off. And then how about that moment? I see over there Beth Shaw, raise your hand, the founder of Yoga Fit International. Ah, yes. There are many ways to be able to assume the vertical and then twist into all those, well, anyway, I'm not doing tree pose in these shoes. But thank you very much for all of the work that you do as well. Are any of my Anytime people here? There we are. Yes, there we are. Good, good. One of our great sponsors in Anytime Fitness International. And I think we have a few success stories we'll be hearing about a little later on. Needless to say, thank you for coming in all this rainy weather. It's just great to see so many people coming together, the blend of physicians and fitness professionals. Who would have thunk, right, Regina? I mean, remember the days we used to just sort of think about this, dream about it, and now it's really happening, and now we even have a curriculum to solidify it. Ooh, speaking of curriculum, I have a smarty pants for you. And that is the head of the American Council on Exercise. Dr. Cedric Bryant is a wonderful friend and colleague and the Chief Science Officer of the American Council on Exercise. So many people recognize his name from all of the multimedia work he has done. He's either authored or co-authored at least 35 books and has written over 300 pieces for the fitness industry, trying to drive home evidence-based, science-based work in our field, which is so terribly important as we integrate physical activity into healthy lifestyle. I asked him what he'd like to do in terms of being a real person and getting out there and walking the talk. He said, golf. I said, what else? You got to have more than golf. Golf is okay. And he said, but I run the tees. Ah, now we're happy. As it turns out, it's all of the above. He's just plain physically active, and he's done this for years and years and years. Someone who walks the talk, hikes the talk, golfs the talk. And that's what we want to see more than anything else. We want to welcome Dr. Bryant, an integral piece with the American Council on Exercise.
Good morning. Thank you, Pam. in the spirit of why we're here today, would you all assume the vertical, please? You guys have been sitting, you've been sitting for over 50 minutes, so I think you deserve a little bit of a break. And you can stand if you want, you can sit whenever you feel comfortable. I'm going to continue on. We've heard several common themes today, and there are a few that I want to focus on. One is that exercise is very beneficial for a diverse array of patients who are impacted by a wide variety of medical conditions. We've also heard about the challenge that we have in getting physicians in the medical community to assess, monitor, and to refer physical activity, despite the evidence that shows that it can be very impactful in eliciting real positive health outcomes. And that's what excites me about this collaboration, in that the Exercise is Medicine initiative really provides a clear path for bridging that divide, for creating that connection between healthcare and fitness. And that's one of the reasons why the American Council on Exercise, when we sat back at that small room at that hotel in Chicago, we're really excited about the prospects of this collaboration. It perfectly is compatible with our mission to get people moving. It supports our advocacy work that we do to try to better position well-qualified, certified fitness professionals. We have 60,000 plus of those individuals to really get those folks positioned on the healthcare continuum. And when you think about people who are appropriately trained and credentialed, particularly with some credentialing in the areas of behavior change and health coaching, are really well suited to help individuals on that journey of change that we're trying to get them to go on, to really help people to make those sustainable small lifestyle changes, regular participation in physical activity being among those, to really experience the benefits of a full, healthy life. And when you think about one of the things that's been a challenge over the years is how do we really kind of connect fitness and healthcare? And I'm a sports nut, and anybody knows me now, I love to move, I live to move. I have 4 boys, and I've had the extreme pleasure of being able to coach just about every sport known to man, and so a lot of things that I look at through the lens of athletics. And when I think about optimal healthcare, I view it as really being the ultimate team sport, where you have many different players with many different roles, and physical activity professionals, fitness professionals, have a role in that sport. And so one of the things that's been a great challenge is, how do the key stakeholders know who's really qualified and suited to entrust their patients to get this counseling that is so needed and so vital? And that's really one of the, I think, cornerstones of the EIM solution, in that the EIM register has individuals who hold accredited certifications from arguably the 2 most respected accrediting bodies. The National Commission for Certifying Agencies, which happens to also be the primary accreditor of many of your healthcare credentials, and then the International Organization for Standards in their 17024 professional personnel certification credentials. So you have 2 bodies who vet the organizations that vet the professionals that you're entrusting your patients to. And so for us at the American Council on Exercise, we view this collaboration as just being an unbelievable opportunity to really start to shift the healthcare paradigm in a very positive direction. Okay, one where individuals can get that guidance, that counseling, that support, getting people who are well-trained and appropriately qualified to come alongside your patients to truly create clinic-to-community connections. Because it's only in kind of creating that true kind of team sport approach to healthcare are we going to be able to accomplish big things. And so that's why we're just so tremendously excited to have the opportunity to be a part of this great initiative. And I know he's probably going to hit me with this tennis racket, but there's an individual in the audience that I'd like to point out. Dr. Nicholas DeNubli, who was a former ACE board member, if you could stand, Nick, and he's an orthopedic surgeon, and he served on the President's Council back in the late 80s under the Bush Senior administration. And Nick is really one of the pioneers with the whole concept of this nexus between fitness and healthcare, this concept of exercise as medicine. And he is a tireless advocate for really changing the way we think about healthcare, and he walks the talk. He's avid in his activity, but he also gives of his time to go to medical schools who will have him to try to influence young docs to start thinking about physical activity as being part of their prescription. And it's our hope that by coming together with two fine organizations like the American College of Sports Medicine and the Medical Fitness Association, that the American Council on Exercise, we can work together to really advance that notion, that exercise truly is medicine and that optimal health care is truly a team sport. I thank you for this opportunity, and I'm looking forward to what we're going to accomplish together, because it's going to be significant. And why don't you stand again so I can get a standing ovation. See, that's one way to get a standing ovation.
Hey, don't go too far away. I need all of the plenary speakers, Dr. Benjamin, up here. What we're going to do now is a Q&A, right? And so you're going to have the opportunity to be able to ask these great leaders any question you have, anything, to be able to help broaden your own understanding and knowledge base about this historic day, the marriage of medicine and fitness. And we have someone with the microphone. You have that? All right. There we are, back there. Okay, let's start with the first question. Anybody? Let's make it happen. Go ahead.
Hi.
When you ask a question, tell us a little bit about who you are.
Okay. Shall I stand? Hi, I'm Beth Shaw. I'm the founder of Yoga Fit Training Systems, and we've trained over 250,000 people worldwide in teaching yoga and fitness. So I'm thrilled to see this happen because, you know, yoga is medicine, and fitness definitely is medicine. I've personally been working out since I'm 15, and not a day goes by that I don't do something that involves movement. I'm so thrilled to see this happen. Will there be any plans for a big conference or symposium? Because I know that there's so many organizations that you all represent, as well as many like Yoga Fit that would like to get involved. And I know that there are some physicians organizations like A4M that provide more healthy information to physicians. So I'm just curious as to how you're going to kind of bring this to the masses in a big way.
Yeah, thank you. That's a great question. So we've already got partners with several medical societies, but I think you're talking about something more than that. You're talking about the implementation in the communities and bringing those to part of it. And absolutely, we want to have appropriately and like-minded fitness organizations join us in this, and we will be looking at ways to do that. So this is the launch event. This is just, in our view, the beginning. And we will definitely be wanting as many like-minded organizations to join us in this.
Great. Thank you all so much for the work that you're doing. Thank you, Pam.
Let me add one quick thing to that. At the Medical Fitness Association, we are actively looking at revising our annual conference to incorporate more organizations looking to break off from the way we currently do things. So it'll probably take 2 to 3 years for that to happen, but we are looking at trying to create a forum that'll bring all these groups together.
Thank you.
I'd just like to say, if you know of any foundations or organizations who might want to sponsor something like this, I think you have a wonderful idea, and we'd love to work with them.
Thank you.
Next question. And could you just tell us who you are?
I'm Nick DeNubli. I'm Cedric's bodyguard.
You're the orthopedic surgeon.
Yes.
with the great background.
With a great backhand.
You got it.
I'm an orthopedic surgeon who does sports medicine. I'm one of the I guess, Chief Medical Advisor for ACE, and I'm VP of A4M that you mentioned. But, and I've kind of devoted my life to trying to get this whole exercise medicine concept and change the way docs act every day with their patients and what they really do in the office when they have no time. It's tough. It's really been almost impossible. And when I was part of the President's Fitness Council, I had one goal. We did a lot of stuff, I thought, with Arnold, but my one goal was to get exercise in the curriculum of every medical school in the country. I thought, this is easy. There's 100 and some medical schools. You go to one organization, they send it down. We hit a lot of walls, and I was able to get it into some of my local medical schools, and what's going on in South Carolina is just remarkable. So my question is, with all this force together now, can we get together a curriculum? We could have a turnkey curriculum. Cedric and I talked about this morning. At least get them started, because one of the barriers is the docs don't have that information. I think docs would do it. They would go into the school, they'd work with the students, but they don't have the time to put this together. They don't have the knowledge. Most doctors don't understand exercise or exercise prescriptions. So, and I volunteer my time, and I'm sure if we got together, we could have a turnkey. And with this kind of a group, how do we really change medical schools? And I'm not talking one at a time, because that's going to take forever. The clock is ticking on this, as someone said. Jen. Thank you.
Okay. Cedric just said you teed this up for me, so that was perfect. Thank you. Again, we're very proud of what we do at USC School of Medicine Greenville. In addition to that, with my partner at Harvard Medical School, Eddie Phillips, who's a physiatrist, we actually have started the Lifestyle Medicine Education Collaborative, to where we've got 5 focus goals. And one of them is supportive deans, one of them is student initiatives, one of them is assessment, so you got to get it on the boards. If you don't get it on the boards, it's not going to be tested. We've got policy, so we've worked with Bipartisan Policy Center, and we've worked with curriculum, so working with AAMC with MedEd Portal to start putting curriculum and content onto MedEd Portal to where other schools could utilize it. So this year we will be having our first summit, our Lifestyle Medicine Education Summit in October, to where we're bringing together medical educators, deans, associate deans, administration, faculty, to where if you want to know how to get exercises medicine, lifestyle medicine into the curriculum, come to the summit and we will teach you how to do that in that changing environment, in that compressed curriculum, in that time factor, how to work with it integratively in the systems-based and the organs-based, behavioral change, how important that is, all of that.
Thank you.
Yeah, thank you. Sure. That's great. I actually serve on the board of an organization, Kaiser Permanente, which has been traditionally, and most of you know, involved in prevention and health outcomes. And we recently announced the fact that we're going to establish a new medical school in Southern California. So in the planning process of all of that, I'm going to certainly bring this to that group and make sure that we incorporate this idea. So we may be calling on you.
Anytime.
This also goes 2 ways, and I throw this out as a challenge and as a marvelous opportunity. We're going to be setting up this wonderful curriculum. We do definitely have a movement now, and part of it is just sheer embarrassment. When you actually read articles in Men's Health, Women's Health, etc., it says, before beginning this, please check in with your doctor, the most clueless person in the room. So I think we're finally getting to the point where it'd be nice if we knew something other than having to look it up on WebMD every time someone comes in. So there's most definitely a movement, especially among the younger physicians. When I say younger, I mean the people coming through the system right now, which is important. But here's the opportunity and challenge as well. What I did in the Washington metropolitan area was I established my own network of fitness professionals. I found yoga studios. I found really great trained individuals at a multitude of health clubs, the Y, et cetera. So I ended up with quite a little folio. And whenever someone would come in, either myself or one of my staff would know precisely how to network. And I had a rule, and the rule was, if I network with you, you give me feedback. No feedback, we're done. Because I want to know. I want to develop an outcome, result for myself. And trust me, it worked like a charm. Now we work together like a family. That's the kind of thing we need to really foster in a big way. So we need to help with all of these organizations here. We need to be able to help fitness professionals get their foot in the door, because it's going to come not just top down, it's coming from everywhere now. It's bang on them. And I'll tell you an easy way to do it. Give them a free workout. Works like a charm. Because how can they sell it if they've never felt it? And many of these people have never had a trainer or anything else. You make some assumptions here, and I'm telling you otherwise. So we've got really great opportunities with everything in exercises medicine. All right, I saw your hand up.
So we need to do the last one.
Okay, go ahead.
Sorry. Okay.
Oh,
Thanks. I wasn't sure if she was going to ask the question or if I was going to ask the question. I hope I didn't take the microphone from you. I'm Bill Crawford. I'm a dinosaur. I've been doing this for 40 years, practicing exercise and fitness to lots and lots and lots of people. But first of all, I want to thank you. Walking around Washington with these enormous buildings, you get a sense of what it's like to push something like this through the bureaucracy. I am the chairman of the board of the National Fitness Hall of Fame, and I represent a lot of people that are in the front lines involved in training people one at a time across the nation. So my question is this: what do you see as the biggest challenge and the connectivity between the medical professional world and the fitness training world, and how do you make that segue?
We're going to take it right on down. Go ahead, start.
Well, my thought, we were just having breakfast this morning, and we're talking about bringing fitness professionals into the medical practice. Wouldn't it be wonderful if all of our exercise physiologists, our kinesiologists served as medical assistants, some type of medical assistant program where they are hand in hand with the physician. And that way they come in, they meet the patient from the very beginning, and they can serve as an effective channel between the doctor's office and the medical facility. So that's one way we can bring more of the people that we really need, which is everybody in this audience. We need you in our offices, and to look for physicians who would champion that type of interaction. One thought.
One of the issues in trying to make this work is the issue of trust. Physicians have to have somebody they can go to trust, and that's kind of where Medical Fitness Association comes in. We're the only certifying body for fitness facilities in the country, and we're in 11 countries. So if you find someone that's got a medical fitness certification, you can feel very assured that you can trust sending those folks there. And we're reaching out beyond just hospital-based fitness centers. We have a number of commercial facilities that are adopting a medically integrated model. Some of the Ys are, some of the Jewish community centers are. So that's a growing effort, and something we certainly will espouse and continue to make sure that people meet the highest levels of accreditation. So it's a trust level.
Thank you. Regina? This could go on.
Well, one of the things that at the American Council on Exercise we're big believers in is helping professionals, whether they're fitness professionals or healthcare professionals, to become more effective communicators. Because if you think about it, most people want to change, they know they need to change, but they really have a very difficult time making those changes. And that's where kind of behavior change, coaching, things like motivational interviewing skills, being able to help people deal with that ambivalence that we all have to change. And so we really think that if we can work towards helping all professionals who deal with real human beings learn how to make a true personal connection, because then you're going to establish that relationship and that trust where you can help that person on that journey of change.
I'll make this really quick. When we started doing this, we were pretty sure we knew this. We have physicians, we have community programs. Our job's to link the two up. So we were proud of ourselves. We went out and talked to the CMO, the C-suites in the healthcare system. They said, we're not doing that. Why not? Well, there's no quality assurance in that. We don't trust sending our patients to the community programs at the moment. So we learned we have to think like a healthcare system does. Now, there are great physician champions here, and those folks, we're lucky, they've developed their own individual networks. So and we're always going to do that. We want to encourage that as much as possible. But for physicians who don't have time to set up their own networks to work with healthcare systems, I think we need to encourage, and we need to make sure there's a quality assurance, which is the whole reason we've got the Exercises Medicine Solution here to provide the quality assurance part for the healthcare systems that may not trust us otherwise.
Some would say a little different in that as clinicians, as physicians and nurses and things, we also need this. Many of us have issues ourselves. Many of us are overweight. We don't have the time. We're stressed. We need the exercise. So we're going to need that as well. So I'm looking to the medical societies and the organizations to be leaders within your organizations. One of the things we're going to be talking about later today is the walking initiatives. Everybody Walk campaign. We have a Surgeon General's report on walking, and walk with your doctor. Get your patients to walk with you. Once we start doing those things, doctors we've seen who walk and have their patients walk with them once a week or whatever tend to be much more revered in their community. They get everything going. We want to get it to become a part of what our clinicians do and a part of what they're doing every day. And so it shouldn't be something extra to do. It should be everyday life. Exercise has to be fun, and we have to incorporate it in everything we do. And I have this whole talk about how much you should have fun, dance with your patients, do fun things. Patients love it, and they'll lead it. I've got patients now. We have a walking trail around our new building after we rebuild after the burning. So they'll do it, but we have to give clinicians a way to make it easy. And this particular Exercises Medicine Solution is making it easier. Tell me where I can go to find the information. When I write that prescription, show me where I can go. I don't have to look it up. I don't have to spend extra time. And that's, I think, what this whole program is going to make it easier for us and for our patients.
Amen. Thank you. Thank you. You know, there's nothing that puts a period at the end of the sentence better than listening to our wonderful U.S. Surgeon General really nail it as a bottom line. There's also one other thing, and that's real human beings who are success stories and people whose lives were touched by this. Where are my anytime people? Where's Cassie?
There she is.
There she is. Stand up. How many pounds? 80. Okay, so she shed a whole lot of medical conditions, threw away, I think a couple of those are yours, isn't that true? And you're a real human being who's gone through this as an Exercises Medicine. Can you just give us a moment of inspiration?
So for me, it all began with exercise. I was in a bad place. I was a working mother, trying to sort of juggle life, and found myself really out of shape and depressed. So I knew what I needed to do. I've been in shape my whole life, but life caught up with me. So I decided to start at the gym. And at first, I couldn't even keep the machine on. It was, resting. And I just said, I need to stick to it. And I did. And slowly but surely, the weight came off. I was able to go faster, stronger, better. And now I'm to the point where I'm running 40 miles a month. I spin several times a month. I've lost 80 pounds. But it's also been for me a health journey. I need to be healthy for myself and for my family. And the weight will come off. Of course, I want to lose more weight, but it's already come off, and I just need to be healthy. I need to take it in increments, which I know is manageable. It's a big mountain to get up, but I'm halfway there. And most importantly, I'm healthy. I can do way more than I could ever do. I'm signed up for a 10K here in a few months. So you can do it, but it's just, you've got to bite off what you know is manageable.
I'm curious. I know that you're working with the Anytime Fitness professionals who are superb. What does your doctor say about this, and what kind of interaction have you had with the physician or primary care provider, whomever it may be?
So my cardiologist, of course, is pleased. My blood pressure is down from 160
Do they really understand what you did?
He knows what I mean, he's encouraged me along the way. So now it's sort of,
All right.
solidly at 120 over 75. My resting heart rate has gone from 80 to 50. I can do just so much more. It's great. I can just feel good. But another thing is I had sleep problems. I had sleep apnea. I'm almost off sleep apnea.
Excellent.
I'm still on it, but at the very lowest pressure that you can have, and I can't wait to get rid of that.
Cassie, I want to thank you for sharing with everyone here at the National Press Club in this room, because I know that's a lot. And I'd like you to do something, if you could. The next time you see each one of your primary care providers or your cardiologists, whomever, invite them for a walk.
I will. And I also want to tell people, you don't have to be a perfect size 8 to be healthy. I'll never be a perfect size 8. I know I won't. But that's okay. I can be healthy. I can run. I can be fit. I can do many, many things. There's nothing that I can't do right now. And I think that that's something important for people to know and understand.
I just thank you so much. Everyone, Cassie. And I've just got to give a shout out to one of my trainers who didn't believe, thought this was an excuse for not showing up this morning at the gym. So she decided to come and just make sure I was doing my work. Liz Cora from the Equinox Health Club. Liz. All right. What I'd like to do now is close this up with some wonderful comments from our boss at the American College of Sports Medicine, a tennis player.
Thank you, Pam. Everybody excited about what we've got going on? Yeah? Yeah? The National Press Club have said, we have done such a great job, it's a wrap. And so they're going to be needing this room, but I did just want to close. When we launched Exercises Medicine with American Medical Association in 2007, one of the things we did is a patient survey of how many physicians were talking to their patients about physical activity. It was like none, so much so that we didn't even release the results of the survey. Fast forward to where we are now, and it is amazing. I want to thank all of you. I want to thank particular partners that we haven't recognized so far, but play very significant roles with us. Don Joy, Michael McBriar, and Tabby King. Michael, please, yeah, thank you so much. And Technogym, Anytime Fitness, Redmond, which is a company in China involved with Exercises Medicine. And also, as we mentioned, the National Fitness Hall of Fame, which will be great, excellent, Bill and Debbie and Greg. We've got a lot of things going on. This truly is transformative, and guess what? Each of you in the respective organization that you have is part of this solution of forward progress. I want to thank you all very much. We are going to try to get out of the room pretty quickly if we can. Photos will be outside, any kind of additional discussion, but I want to applaud your leadership and truly bringing transformation not only to this country, but to the world. Thank you all so very much for being here.